Going to start massaging the shoulders using body weight back and forth. In a more Eastern style, I like to use circular movements with the forearm at different tempos, fast and slow. Never digging my elbow around that area. It's a very sensitive area if you use a point. Here I'm going to use my elbow with a sink and a quick release, a sink and a quick release. So it's not painful. They're just points. I'm not grating and going cross fibers or grating around the muscle with my elbow. It's just sink and release. Circles covering the lats, going all the way down the back, down the paraspinals. Another view on the other side of the body. I always like to adjust the pressure and the angle of my arm according to the body type. He's a little bit on a mesomorph, so I like to have stronger pressure, a little bit more body weight, a little bit more angles into the meat of the muscle versus an ectomorph where I would be covering longer strokes and surface areas. Some pressure points down the paraspinals. Compressions. Like to push up near the occipital point. Grabbing the anterior delts with the fingers and the back with the thumbs and the infraspinatus. Pressure points down the extensors. Little cross fiber action. Pressure point for pain, and I pop their fingers very loose and fast. It's supposed to be a release of pressure. It's not supposed to be you're popping their joints. That would be very unpleasant. And stretching his flexor muscles. Now I'm going beneath the scapula, from where the rhomboids is towards the subscapulars. But I'm really just getting underneath that scap. Using my elbow. And very gentle stretching. Be careful because you can hurt the shoulder. And hand reflexology. Changing the tempo up to fast. It's always good to get the blood flowing and mixing up fast and slow. Using my legs to get down his IT band with a lot of body weight. It's very relieving to the patient. Now I'm using my knees to get into his gluteus. And pressure points down the IT bands with the thumbs, and then we're going to finish off with the calves and the Achilles heel.